There are many factors that can have an adverse impact on sexuality, both interest in sex and sexual performance. And many of these apply to both men and women. One of the more common medications that we prescribe in our society are referred to as SSRIs. These are a group of antidepressant medications that are very, very effective, or can be very effective, in dealing with a very painful condition known as unipolar depression. But one of the side effects of the SSRIs, and it's universal, is that it either decreases interest in sex, decreases the ability to have either an orgasm or an ejaculation, and a little less so on the impact of actually having an erection. However, if you're not interested, hard to have an erection, because that's part of the process. You've got to be interested. And as a class, they affect the sexual area. We're struggling a little bit in trying to see if we can reverse this, and all of us have strategies that we've developed, either lowering the dose, adding another agent that may counteract it, but they're not perfect. On the other hand, depression is not a disease that you can leave untreated, and I think that's where the dilemma is. Some of the birth control pills may have an effect, usually not as striking as the SSRIs, obviously. Blood pressure medicines, especially the beta blockers, diuretics, the old kinds of medications that we used to use, Aldemed, Serpine, all these older drugs all had a major effect. The newer generation blood pressure medicines have much less. If anything, they may even have some prosexual effects. The ACEs and the ARBs are pretty much sexually neutral. But I think that, and we know that alcohol certainly can have a depressant effects on sexual performance. Antihistamines, in theory, could have a inhibiting effect, not necessarily that powerfully, but anything can have an impact on. So one of the things that I always ask patients who come in with sexual issues are, what medicines are they taking? Sometimes it's just the medicine themselves that's the problem.